The next speaker for the National Symposium today is our beloved Medical Superintendent, Dr. Naveen G. He would be enlightening us with the topic Management of COVID-19 by Naturopathy and Yoga. To describe about Sir, Dr. Naveen G Halappa is a BNYS medical graduate with Masters in Yoga Therapy from Manipal University, UGC NET qualified in Yoga, and a PhD in Yoga and Psychiatry from NIMANS, the Institute of National Importance, Bangalore. His main achievements include he being the first person from BNYS to get PhD from NIMANS Institute and the first one to serve from the BNYS background as a chair for yoga as at Leibniz University, Germany, and he also represented the Government of India. He has 14 international level publications. He has received 2 research project grants from Ayush and DST Government of India. Currently, he is working as the medical superintendent at Enapaya Naturopathy and Yoga Hospital, Enapaya deemed to be University, Bangalore. Over to you, sir. Kindly enlighten us with your topic, Management of COVID-19 by Naturopathy and Yoga. Okay, sir.
Thank you, Dr. Sangeeta, for giving a wonderful introduction. Today I will be talking to the audience about yoga and naturopathic medicine in COVID-19, preventive and adjuvant measure. Much of the ground level presentation, what is required for naturopathy and yoga, has been done by Dr. Sijit Sridhar, who was the first speaker of the today's Naturopathy Day National Symposium. So I don't want to cover, I may skip few slides, but I will go core into naturopathy and yoga in the prevention and to utilize as an adjuvant measure in COVID-19 pandemic. Yeah, so I will be talking about the introduction about COVID-19, which all of you are aware of. Introduction to yoga and naturopathic medicine in brief, and rationale for the use of yoga and naturopathy in COVID-19, and top 25 tips which I thought which could be useful as a preventive measure, as an adjuvant measure, along with conventional medicine to manage COVID-19. So current status of evidence in these areas, though it is a new medical condition, we have some evidence and some indirect evidence where we could suggest yoga and naturopathic medicine could be an evidence-based medicine which is available, and summary of findings and conclusions. So as you know, COVID-19 is a new disease caused by newly identified single stranded positive sense RNA coronavirus called SARS-CoV-2, which is related to SARS and MERS coronaviruses. So signs and symptoms which you know, which is like a flu-like symptoms that worsen with fever. Patients will have cough or shortness of breath, running nose, body aches, diarrhea, and sore throat. And most of the patients who are asymptomatic carriers, they may not have the symptoms. So when it comes to incidence and prevalence rate of COVID-19, already we have come across around 5 crore 43 lakhs patients who have suffered from COVID-19, and mortality rate is around 13 lakhs. And approximately in India, it is around 4,53,401 cases, and death rate is around 1,30,519. Okay, there's some disturbances. Sorry for the disturbance. So when we get into the principles of naturopathy, already Dr. Sridhar has talked about that. So just I have enlisted some of the principles of naturopathy here. So expectation from naturopathy consultation. So we have a wide range of naturopathy and yoga treatment modalities. Interestingly, most of these treatment modalities are evidence-based. And this very interesting slide where we know that Hippocrates is the father of modern medicine, and he is also a he's a father of modern naturopathy also as well. This is where we have the common aspect between conventional medicine and naturopathy. So he has given the concept of vitalism. You could see the different mood states of an individual. So what is very important is we have to balance the 5 great elements according to naturopathy. Don't want to go in detail about this. So in general, if you talk about health, depends upon all these 5 aspects. What kind of diet which you take, how do you think, whether you think positively, makes a lot of sense. And whether you do yoga and exercise, both are very, very important. And how you are leading your lifestyle from morning to evening, and even how you are relaxed from within. So these things which help to maintain optimum health of an individual. So the current trend is to improve, to optimize the immune response, not increasing the immunity, which is a wrong statement which has been used after this COVID-19 has become a pandemic across the globe. So what is very important is we have to optimize the immunity. So this is one of the talking point where Ayush system of medicine, it may be Ayurveda, or yoga and naturopathy, or Unani, or Siddha, homeopathy, which has a common bond, where we can improve the immunity, can optimize the immunity in the individual. So any delay in the onset of the production of antibodies, which commonly we see in comorbid medical conditions like diabetes mellitus or hypertension or any other kidney renal conditions, where the production of antibodies, it will take a longer time, and prolonging the inflammation which happens in these cases. That is the reason why comorbid conditions patients, they are more vulnerable to COVID-19. So inflammation is very, very important as a repair mechanism, natural repair mechanism. However, the prolonged inflammation, which is the one which is going to cause more problem to us. So therefore, it is imperative to optimize the immune response and not to boost the immunity, because over immune response also will cause problem, like cytokines storm, which we know, which is very much common in COVID patients who have been hospitalized, those who are with ventilator. So we need to be self-reliant on our innate and adaptive immune responses. So innate responses can be more when we have the immunity at the birth, and how our the pregnant mother immunity that will percolate into the child. So adaptive immunity, where we can improve during the lifestyle. So what influences the immunity? All these aspects which influences immunity, like nutrition and diet, what kind of diet which you take, environmental stimulation, surrounding environment, learning, how you are going to learn, how you are having social contact, exercise, yoga, and relaxation. Even maybe some other aspects also as well, which influences the, optimizes the immunity. So let me go with top 25 tips where we can help to prevent COVID-19. The gold standard as per the government guidelines is social distancing and hygienic measures which we need to take. This is very, very top important aspect to prevent the COVID-19 and to reduce the transmission of viruses. Third tip is to manage the stress with positive mental health. What is mental health? Mental health is nothing but a state of well-being in which every individual realizes his own potential, and he is able to cope up with the normal stressors which we come across in day-to-day life. Now the main stressor is COVID-19 pandemic. How we are going to address, how we are going to cope up with the stress, that matters a lot. If you're more stressed up, we'll get into trouble very easily. And the person is able to cope up with the normal stressors in the day-to-day life, and is able to contribute in one or the other way to the community. That is what mental health person is. So 2017 theme of World Mental Health Day is depression. Let's talk. So World Mental Health Day. So generally what happens is we think that we have become engineer or doctors, and we are very rich. We don't want to talk with others. So that is one of the main reasons why we come across many medical conditions. Even I, a person may not be knowing. So these were WHO suggested. Let's talk. So this was a study which was done in Enhance, so is part of my PhD thesis also as well, where though it is not directly related to COVID-19 depression scores, but we can correlate this with the COVID-19, because COVID-19 patients would suffer from depression and anxiety and other psychiatric issues. So what we observed is there was a reduction in serum cortisol levels and increase in serum BDNF level, which is much implicated in the pathophysiology of depression. Also, we could see enhancement in neuropsychological functions with the yoga and yoga plus medication group. So this was published in a very good journal. And cortisol level, which you could see here, the drop in cortisol levels, which is the stress marker. Whenever the person would have prolonged stress or acute stress, the cortisol level will tend to increase. So the practices which help to reduce the depression: backbending postures, inverted postures, Surya Namaskara, etc. And tip number 4 and 5, to avoid social stigma. So whenever some person would, suppose many health workers are there in our university, when they go back to their village, people don't, they look at with different way. So these are some social stigma which we need to address, for example, and we need to reduce our fear and anxiety towards COVID pandemic. Whenever if we cultivate more fear and anxiety, the susceptibility to acquire the infections will become stronger, and the susceptibility will become more to get infected with COVID-19. So we need to reduce our fear and anxiety, which is possible with yoga and other mindfulness techniques. Tip number 6 and 7 is to utilize pre and probiotics. In our ancient India, we used to use pre and probiotics more in our diet. Prebiotics is nothing but which is nourishing the healthy bacteria. For example, the germinated seeds which we consume, which is enriched with oligopolysaccharides, and the probiotics commonly which we use in traditional India is we soak the rice in the night and we use it in the early morning along with the curd. So curd itself is one of the probiotic, buttermilk also as well. So it can be used, and now in the market also we have many probiotics which can help because there is a link between gut and brain. That's what we call gut and brain axis. So this will be very useful to, also it has been shown to improve the immunity of an individual. And very interesting aspect is these gut microorganisms, healthy bacteria, which tend to secrete the neurotransmitters like noradrenaline, GABA, serotonin, dopamine, and acetylcholine, which is highly implicated in neuropsychiatric disorders. So healthy nutrition is the key. We need to consume whole grain cereals, not the polished rice. We have to use the unpolished rice and millets and other ragi, jowar, etc. At the same time, we need to balance our nutrition with proteins and vitamins and minerals and the healthy fat, which I'm going to talk in coming slides, which is very useful. And eighth very important tip is to use Indian spices. So generally Westerners, they don't consume more spices. One of the reason we have probably one of the reasons for less mortality rate in India is the usage of spices. More particularly the turmeric, which is very important, which is a potent inhibitor of NLRP3 inflammasome, which is very important in the secretion of cytokines, pro-inflammatory cytokines. So garlic, which has a content allicin, which acts as a virucidal agent and which enhances the pathogen attacking activity of T cells, neutrophils, and macrophages. And ginger is one more important spice which we can use as an antimicrobial activity due to the presence of gingerol. Peppermint also very important spice with pepper which we use, which possesses antiviral activity, which may be attributed to the presence of more polyphenols in that. Licorice, which we commonly call ishtimadu or jeshamadu, which contains glycyrrhizin, which induces interference, which cause significant antiviral activity. Glycerin was shown to directly inhibit the growth of several DNA and RNA related viruses, cell cultures. Tip number 9 is vegetables and fruits. See, we know that the grapes, which is a very important antioxidant, which contains resveratrol, and quercetin, which is more commonly found in onion, broccoli, cherries, grapes, and citrus fruits, are the potent inhibitors of NLRP3 inflammasome, which we discussed earlier, which is responsible for the cytokine storm, which you commonly see in susceptible COVID individuals. Pineapple, which acts as an antitussive agent, which can be used to reduce the cough. So whole grains, fruits, and vegetables should be used. So tip 10 is not just the macronutrients. We have to utilize the micronutrients, such as the vitamins and minerals, to enhance the immunity. More important vitamins, which is very important, is vitamin C, vitamin A, and vitamin D. So vitamin C, which we know that it is profoundly found in citrus fruits, and vitamin A, which carotenes, which bioflavonoids, which we find in green leafy vegetables, which is very important, which acts as a antiviral and to improve, optimize our immunity. Tip number 11 is to utilize the basic Indian herbs, which we use, like tulsi, which acts as an antimicrobial. The other herbs which has been found to be useful in HIV, like neem, and Adathoda vasica can be useful to reduce the cough symptoms. So tip number 12 is yoga, asanas, and pranayama. So generally back bending postures, which are very important to improve the lung functions, and also the pranayama, where deep breathing practices also very useful, and fast breathing practices also very useful, where yoga provides a strong influence on IRF, interferon regulatory factor, and antioxidant, that is superoxide dismutase. And yoga has been shown to improve leukocytes, monocytes, and lymphocytes, which is a main core of immune system. Breathing exercises and pranayama, the recent study which was done in COVID patients, as we know, it is not easy to wear the mask for when you go out. So generally, when we think about if it is a overcrowd, it is always mandatory to use. But if you're going in a very, though it is airborne, which I believe, we need to optimize our immunity with natural lifestyle. So if we have, there are some exceptions like comorbid medical conditions or geriatric population. We should not use mask for long, unless you are working in the hospital with the COVID patients or in the hospital settings. So what would happen is carbon dioxide accumulation, which takes place, and we don't have better oxygenation, which would impair the functions of our cells. So what they could see is the perceived exertion level was reduced after the practice of these breathing exercises like Anulom Vilom Pranayama and some other practices where they used diaphragmatic breathing exercises. Uh, it reduced the physical exertion which we come across after wearing the mask. So one more very important aspect in yoga is yogic kriya, that is tip number 3, Jalaneti, which helps in preventing and managing upper respiratory tract infections. Why it will help? Because it will improve the mucociliary clearance, which is one of the main defense system which we have in the respiratory system, which try to expel the invading foreign body to the external environment. So, and also kriyas will help to thin the mucus and decreases the local inflammation, which help to which is very, very important. The person has to do regularly, at least for 2 to 3 times, if you want to reduce the transmission and to prevent the COVID. Other kriyas like hypotonic saline nasal irrigation is one of the research study which was done, and along with gargling, where they could see the duration of coronavirus upper respiratory tract infection was reduced for almost 2.5 days, and also symptom score has been reduced, and the medication usage was reduced with this. The steam inhalation also very important aspect which you can use in COVID-19 management. And meditation, which is very important because melatonin level has been improved, increased after the practice of meditation. Why melatonin is important? Because melatonin would improve if you have a better sleep quality, and it is very important in tissue regeneration and tissue repair. So, and even it has a role in inflammation as well. So meditation increases growth factors, and meditation has been observed to improve the cortical thickness to improve your cognitive functions. Cortical thickness. So they have used meditation and yoga practice as a potential adjuvant treatment of SARS-CoV-2 infection and COVID-19. Concept of this, I just skipped this slide due to shortage of time. Tip number 15 is cultivation and reinforcing positive attitude. So this makes a lot of sense because our white blood cells level can increase if you are more positive. And here you could observe increased secretory immunoglobulin A function, natural killer cell activity, and cell-mediated immunity than those who are pessimists when we compare with the optimists. Tip number 16 is to improve our sleep quality. As I discussed, melatonin level is very, very important. When we have adequate sleep, melatonin level can be improved. And many of us would do mistake. We use the bed light while we sleep. This won't help us to improve our melatonin levels. So the sleep quality in terms of NREM sleep, non-rapid eye movement sleep, this is a deep sleep, which you tend to improve with the practice of yoga and meditation and other naturopathic lifestyle interventions. It improves the immunity as well. Tip number 17, sunbath. Sunbath is very important, which has been used as a therapy in naturopathy. Vitamin D, which can induce catalycidins and defensins, which have a property to lower the viral replication rates and reduce the concentration of pro-inflammatory cytokines. And UV rays generally, which is very, very important, which we can expose to the sun between 10 to 2 p.m. is the ideal time for 20 to 30 minutes. So avoid the sunscreen, which would reduce the absorption of vitamin D. Magnetotherapy. So magnetic fields has been shown to improve the immune system by even it will increase the pH. So alkaline tea, which is one of the important management criteria for naturopathy treatment guidelines. So acupressure, tip number 19. And superfoods is very, very important. We need to use more fruits and vegetable salad. Green foods like seaweeds, like spirulina, blue-green algae, wheatgrass can be used. Nuts like walnuts and almonds are very, very important. Walnuts, which is enriched with omega-3 fatty acids. And sprouts, alfalfa particularly, which has most of the amino acids. Whole grains, fermented foods, which we discussed, and cholesterol which we all know that which enhances our innate immunity. And coconut, which has been widely used right now, which has a lot of evidence to improve our immunity and to reduce the inflammation. Regular tip number 21 is regular moderate exercise is very, very important. See, many of us think that exercise would stimulate the sympathetic nervous system functions. So we need to think properly here, because if we do unaccustomed exercise or overtraining, or that will leads to irregular exercise, that will lead to the production of pro-inflammatory cytokines. Otherwise, if you do exercise, moderate exercise, and with regularity, that would decrease pro-inflammatory cytokines. These were the difference between how we need to think. So tip number 22 is to restrict excess calories. As we know, during lockdown, most of the software engineers and other professionals have been sitting at home and they have been working. So the tendency is the family members would try to give us more food at different intervals. So we tend to develop the binge eating habit. So this will enhances the susceptibility to get the medical conditions like obesity or diabetes mellitus. So it is very, very important to restrict our excess calories during the home stay. Tip number 22 is we need to utilize the natural water, though hot water is recommended right now. However, to boost the immunity, natural water, spring water is very, very essential. Nowadays, we have been using reverse osmosis water, RO water, which is divide off most of the minerals. So we need to address this issue. Tip number 24 is vegetarianism. As we know, WHO already suggested more than 70% of the virus-related infections among the communicable diseases, which is coming from eating meat, zoonotic diseases, animal-based. So it is always recommendable to use a vegan or vegetarianism diet. And fasting. Periodic fasting is not advisable in COVID-19 because there is some evidence that where bacterial infection, fasting has been shown to be useful, but viral infections, periodic fasting has not been found to be useful. So, however, you can switch on to either intermittent fasting, where we have 16-hour window period, 8 hours is the window period where you are going to consume the food, and 16 hours you are going to fast. This will help to reduce the oxidative stress and inflammation, which is key in the management of COVID-19. And weekly once fasting also can be recommendable. Tip number 25. So it's a very, very interesting aspect. This aspect is microbial exposure during early life, which gives us to less incidence and prevalence of communicable diseases. Why? Because India, we have many slum areas, densely populated Indian people who are residing in different cities and villages. So we don't have the proper environment influences also, like pollution, and we don't get proper water, pure water. And what we observed is the death rate has been less in India compared to other countries like USA or Germany. When I was in Europe, I never came across cough or cold or fever. The reason is we are not exposed to much microbes there, but here we are exposed to microbes that will make us to be more stronger with our adaptive and innate immunity. So CCRVN has done recent study which showed to improve the sleep quality and quality of life, reduction of stress in COVID patients. This CCRVN pilot project. So possible mechanisms of actions of yoga in COVID-19, changes in hypothalamo-pituitary axis, reduction in basal cortisol and catecholamine secretion, changes in the autonomic nervous system function, decrease in the sympathetic activity, and improvement in the parasympathetic nervous system activity, stimulation of vagus nerve, regulating the neurotransmitters, sleep quality, solitary effects on the cognitive functions and cerebral neurophysiology, reduction in pro-inflammatory cytokines, improved emotional regulation by reducing the rumination, and reduction in oxidative stress inflammation. These where yoga and naturopathy could be useful in COVID-19. Take-home message is to expose ourselves to sunlight for 15 to 20 minutes every day within between 10 and 2 p.m. where UVB rays are more prevalent. Drink 2 to 3 liters of hot water daily during the COVID situation. But rest of the life, we need to use the spring water or tap water, not RO water. Consume fresh and wholesome food with spices and herbs possessing immunity optimizing function. Take plenty of micronutrients and natural probiotics. Practice regular yoga, physical exercises, breathing exercises, and meditation. Restrict on excess calories. Have positive attitude of mind. Adopt hygienic and sanitary measures. The social distancing has been given by government. Any questions? I will be happy to answer. Thank you.
Questions? No questions? I will conclude. Thank you, Dr. Naveen G, for your detailed words on how naturopathy and yoga can manage COVID-19. Thank you, sir. With this, we come to the end of the National Symposium. I would once again like to take this opportunity to thank all the guests, invitees, delegates, and the participants for your time. And also, I would like to express deep gratitude to the NFIR deemed to be university for making this event happen. I, Dr. Sangeeta Lakshmi, signing out for this program. Thank you. Namaste.